So what exactly is the difference between peripheral artery disease, PAD, and peripheral venous disease, PVD? Both conditions affect the blood vessels outside the heart, and are considered types of peripheral vascular disease. The blood vessels, which are the arteries and veins, are responsible for transporting blood, oxygen, and waste throughout the body. In PAD, the arteries are not functioning properly, which can result in a lack of oxygen and nutrients reaching the feet and legs. On the other hand, PVD affects the veins, causing a buildup of fluid and other blood materials in the limbs. So, what's the difference between peripheral artery disease, PAD, and peripheral venous disease, PVD? Well, it all comes down to the blood vessels involved. With PAD, it's all about the arteries. These are the vessels that carry oxygen-rich blood away from your heart to the rest of your body, and when they become narrowed or blocked, that's when PAD comes into play. On the other hand, PVD is all about the veins. These are the vessels that bring the blood back to your heart, and when there are problems with these veins, that's when you're dealing with PVD. So, in a nutshell, PAD is about issues with the arteries, and PVD is about issues with the veins. When plaque, cholesterol, and other substances build up within an artery's wall, it can make the artery narrower and block blood flow. This decreases the amount of oxygen and nutrients that reach the limbs, potentially causing lasting damage to the skin, nerves, and muscle tissue. Injuries to the arteries, unusual muscle or ligament shapes, and infections are less common causes of PAD. PVD has various forms, including chronic venous insufficiency, where blood flows backwards due to faulty vein valves. This can lead to pressure and strain that damages tissues and causes bulging veins, especially in pregnant women, overweight individuals, or those who sit or stand for long periods. On the milder end, this can result in spider veins, while in more severe cases, it can lead to painful varicose veins. When it comes to peripheral artery disease, or PAD, many people may not even realize they have it because half of those affected don't have any symptoms. However, for those who do experience symptoms, they may feel cramping in one or both of their lower legs when they are active, but not when they rest. This is known as intermittent claudication. In more severe cases, called critical limb-threatening ischemia, the lack of blood supply can lead to visible damage on the limbs. Some other symptoms of PAD can include numbness, weakness, or heaviness in the legs. Pain in specific areas at certain times, such as at night. Changes in skin color or temperature, hair loss, or wounds that don't heal. A weak pulse. On the other hand, peripheral venous disease can cause visible changes in the legs, such as small damaged veins called spider veins, or larger, twisted veins known as varicose veins. Along with these visible changes, people may also experience uncomfortable symptoms in their legs, including aching or heaviness, burning, throbbing, or muscle cramps, swelling, pain that worsens when in one position for a long time, itching around the veins. When you suspect you have peripheral artery disease or peripheral venous disease, it's important to schedule a doctor visit and ask about your symptoms. The doctor may use the ankle brachial index to diagnose PAD, which compares blood pressure levels in your ankles and arms. They may also use imaging tests like ultrasound and angiography to get a better look at your vascular system. For diagnosing PVD, doctors use duplex ultrasound, an imaging test to examine your leg veins and blood flow. Treatment for PAD may involve medications such as aspirin and clopidogrel to prevent blood clots. Your doctor may also prescribe drugs to control high blood pressure and cholesterol. Exercise training and medications like cilostazol can help improve walking capacity. Healthy habits like regular exercise and quitting smoking can also aid in the treatment. In some cases, a procedure called revascularization may be needed to open the arteries. This can be done through traditional surgery or a less invasive catheter procedure. In advanced PAD, amputation of all or part of a leg may be necessary. For PVD, treatment includes simple measures to keep the blood flowing properly, such as elevating your feet and wearing compression stockings. Regular exercise is also important. Other options for PVD treatment may include medications to encourage blood flow and procedures like laser or radiofrequency ablation to close affected veins using heat from a catheter. More severe cases of PVD may benefit from sclerotherapy, where an injected chemical causes scarring to close diseased veins, or surgery. Taking care of yourself is essential in preventing peripheral artery disease, PAD, and peripheral venous disease, PVD. This includes getting regular exercise, eating a healthy diet, and avoiding smoking. It's also important to manage other conditions such as high blood pressure, high cholesterol, and diabetes. If you experience any symptoms, be sure to consult your doctor. Catching these conditions early can help prevent them from worsening.